Maternal mental health refers to the mother's overall emotional, social, and mental well-being, both during and after delivery. So the common maternal mental health disorders range from postpartum depression, we have anxiety, and we also have a post-traumatic stress disorder. Those are the most common that have been identified, because we realize 1 in 4 mothers antenatally and 1 in 5 in every 5 mothers postnatally suffer from these mental disorders. There's no one cause as per se, but we have common causes. We have the biological, which is genetic. There's genetic predisposition, just like medical conditions, even psychological disorders, we have genetic predisposition. We have psychological causes, which could be due to trauma, that is physical trauma or emotional trauma, and even personality type. And then we have the social aspect, where we are looking at the family, we are looking at the environment where we stay. We could also have what we call marital conflicts. We could have marital conflicts where there's no emotional support from the spouses. We could also have cases where we have new mothers or first-time mothers. Sometimes you have a child with special need. It could be stressful, or preterm baby, and they need this care. It can be stressful to the mother. We also have multiple pregnancies or deliveries, because we are taking more care of more than one child, and this can be stressful. And then pregnancy complications, maybe even during delivery it was traumatic experience. So for most mothers, sometimes it spills even to postnatally. Signs and symptoms depend on the psychological condition you're looking at. So I'll give an overview just for us to look at. So when we're looking at signs and symptoms, they stem from maybe 4 areas. We have the physical symptoms, where sometimes we have a poor appetite, poor sleep, fatigueness in terms of low energy levels. When you come to cognitive functions, we have cognitive symptoms. We have areas like poor decision making, irrational thoughts, negative thoughts. When it comes to behavioral, you are not able to take care of yourself. There's bizarre behavior sometimes. You engage in poor anger management in terms of behavioral. And then when it comes to emotional, there's sadness, there's fear, and all that. So it depends on the psychological condition you're looking at. So in prevention, we are looking at the primary prevention. We talk about creating awareness in terms of giving education and informing the public about this. When it comes to secondary prevention, we have early screening, where you can screen early detect these psychological issues, and we're able to help the mothers. And when it comes to tertiary prevention, we have the curative bit of it, where now we are talking about use of medications. Like if it's depression, we are looking at use of medication like antidepressants, antipsychotic drugs, mood stabilizers. And then we have what we call therapy. In therapy, that is the psychotherapy, the most common technique used is what we call the cognitive behavioral therapy, which helps patients suffering from these psychological disorders in terms of their thoughts, in terms of their feelings, and also in terms of behavior change. Here at Shah Hospital, we promote what we call the biopsychosocial model of approach, where we are not only focusing on the physical health of the patient in terms of their pregnancies alone, we also look at the psychosocial aspect of it. So we have our clinic here at the Diabetic Care Center on the 3rd floor, Doctor's Plaza. Our clinics run from Monday to Friday from 8 a.m. to 5 p.m. There's no health without mental health.